success story.
Just launched by an East Bay fertility doctor.
Hi, you guys. Thank you for joining me on tonight's Egg Whisperer show. I'm Dr. Aimee, just like my shirt says, and I'm here in the San Francisco Bay Area. And after a long day of seeing patients, I really enjoy coming to my studio here in San Ramon to talk to you guys about fertility topics and subjects that are near and dear to my heart. I imagine that one of the most Googled terms out there right now is, what is IVF? And in order to talk about this, you should know what it means to me. IVF literally stands for is very fun. Okay, maybe not literally. And I consider it fun. I consider it a really efficient way to help people get pregnant. And there are people that I'm helping in 2019 that I might not have been able to help even like 6 years ago because of how technology has changed. So it's certainly an amazing time to be a fertility doctor. So if you're someone who maybe tried IVF in the past and wants a new perspective and wants to learn more about how IVF in 2019 can help you, I certainly welcome you to see a local fertility doctor so you can get the help that you really need and deserve. So one of the things that I think is really important when talking about what is IVF is talking about what it isn't, because I think so many times patients come in and they see me with these biases already about what it is, and oftentimes these are what I call IVF myths. So let's just break this down. Number one, it makes you run out of eggs and puts you into menopause faster. That's not true. You hear about women going through IVF and they have eggs retrieved from their ovaries. And sometimes people think, oh, so I had 10 eggs retrieved, that means I'm going to go into menopause 10 months sooner because I have 10 less eggs. Well, that's actually not how it works. The way it works is this. Every month, for example, think of swimmers at the side of a swimming pool. A bunch of swimmers jump in the pool, and at the end in a natural cycle, one egg will win that race. All the swimmers will jump out, and no one can go back into the pool at the end. Well, when you go through IVF, what happens is you try and get all the swimmers to win the race and you collect them at the end, and that's what the egg retrieval is. But certainly we don't make women go through menopause faster. I consider myself an egg rescuer sitting at the sideline of that pool, throwing out little life vests to the cute eggs as I try and get them out of that pool and turn them into embryos for later. The other thing people really worry about it, and I totally get it, because of stuff that people see online is that IVF can cause birth defects, cancer, autism. That's probably the three things. Those things are probably the three things that most of my patients worry about. You know, they're so worried about what is IVF going to do to me. And it seems, based on really nice large studies, that IVF does not cause cancer. It does not cause autism. We know that a lot of autism could be caused by people who are trying for babies later in life, environmental exposures, age-related issues, just like I said. And as far as the birth defects aspect, there is a slight increased risk of having a baby with birth defects if you use a procedure called ICSI. But I think that maybe sometimes it has to do with people with very low sperm counts, and that in and of itself can be associated with some genetic issues and may cause that birth defect issue that we see. But at the end of the day, please talk to your doctor about your own concerns so that you're not going into this process with a bias or concerns that may not be valid. I don't want people worrying about, oh my goodness, I'm going to cause this or that in the future for myself or my children, when those things are not true. The other thing is that IVF isn't, is it will not ruin your chances of conceiving later, because IVF doesn't harm your fertility. But at the same time, IVF does not increase your chances of getting pregnant later. See, I've had patients who say to me, Aimee, I don't need to preserve more embryos because I know, because, my neighbor, she told me that if I got pregnant with IVF, now my next baby will actually be easy and I won't have a problem getting pregnant. I would love for that to be the case. I would love for every patient who struggled with fertility not to have the struggle, number one, and no one to need my help, number two. And certainly if you needed my help, wouldn't it be awesome if you didn't have to see me again? But if you did, I certainly wouldn't want you to regret not having had done the work to preserve your fertility, make those embryos when you still had healthy eggs. So super important to think about. And the other thing that IVF isn't, it isn't a way to just ignore sperm issues and just say, oh, at least there's sperm, we don't need to worry about it, because sperm does matter. So looking at sperm count is great, but I like to do deeper dives sometimes, especially if a guy has, let's say, medical problems, is overweight, might drink a little bit too much, smoke cigarettes, so it's important to do some sperm DNA testing as well. And IVF certainly does not create super babies or healthier babies. It is still not dangerous to get pregnant at home, because I promise you, I can only work with the DNA that people have. I can't make their DNA better or promise a baby with a higher IQ or someone who's taller or whatever it is that you think based on what you've seen online. We cannot make designer babies through IVF. We can't pick eye color. Those things are just an IVF myth. So now just a quick biology overview. Every woman's born with a certain number of eggs and we lose them over time. I know, you guys already know that stuff. And that number is based on genetics, environment, and age. You ovulate one egg, just like my swimmer analogy, but through IVF, we try and recruit whatever that cohort is that you have at the start of that month, and then we try and retrieve them, make embryos out of them, and then put them in the uterus through a procedure called an embryo transfer. And the potential that's different between each woman can be determined by several factors. So those factors are AFC, which is the antral follicle count, the small number of follicles we count in the ovary, and that's something that your doctor will do probably at your initial consult, and then also repeat at your baseline ultrasound. Then we have the anti-Mullerian hormone level, which is a hormone secreted by cells that surround eggs. The higher the level, the more mature eggs you might have, and that number is correlated with, like I said, mature eggs. But knowing that number, along with your age and your FSH and estradiol level, all give us a really good idea about your egg quality. So I like to lay out plans for patients and say things like, based on the number of kids that you guys want from here, it seems like this is the number of cycles we might need to do, and this is the chance that we'll be able to get the number of embryos that you want in your first cycle, and the likelihood of us needing a second. If you have a doctor that isn't asking or telling you those things, ask those questions. Ask them, how many healthy embryos do you think I'm going to get from this cycle? How many cycles do you think I need based on this number of kids that I want? Because certainly, guys, you take a breath. If I was a guy, I would have just made 6,000 sperm cells. Does not work like that for women. And certainly, this isn't about scare tactics. We don't talk about menopause in a way in my office that makes it seem scary. It just happens to everyone, and it's inevitable. And I certainly don't want women looking back and say, why didn't I do more when I still could have? So now, let's talk about the antral follicle count and how it's done. It's an ultrasound. And if you didn't know already, the way we look at the ovaries is through something called my wand, or pelvic ultrasound probe, inside the vagina. There are patients, and I like to accommodate everyone's comfort levels. And what I mean by that, I have had patients where I've done an entire IVF cycle and all the monitoring without a single pelvic ultrasound, because there are people that actually are super uncomfortable and have never had anything inserted inside there, including a tampon. And I can definitely understand that and make accommodations for anybody. You can see the follicles on an abdominal ultrasound. It's just not as easy or as exact. But a transvaginal ultrasound is the way to see them quite accurately, and that count does translate for the most part into the number of follicles that you may be able to grow. It does not always correlate with the number of mature eggs you'll get out, but knowing what your starting number is, you kind of have a good idea as to what to expect down the line after your next visit. So that's what an antral follicle count is. You saw those big circles I just showed you, and there is a microscopic egg here depicted on the screen right behind me inside each of those follicles, and that's what we hope to get. We hope to get a mature egg, also called an M2. Mature eggs are the eggs that can get fertilized by sperm. Immature eggs might have a chance of getting fertilized, and the other eggs, like germinal vesicles, and sometimes you hear the word atretic, those eggs do not. We do not have a reliable, stable way of growing immature eggs outside the body to become mature and then later get fertilized by sperm. So once we have the egg, we have several decisions to make. Do we freeze it? And that's basically egg freezing, which is IVF without the F part. And then we have the F part, which is the fertilization process. I like to do a procedure called PIXI, which is where you take the sperm, put it on a special dish. The genetically normal or morphologically normal sperm cells with a normal shape, will bind to that dish. And then we pick up those sperm cells and put them into the egg. Okay, so that's what ICSI is, intracytoplasmic sperm injection. You can also just bathe an egg with about 200,000 sperm cells or so through a process called IVF, and we call that IVF without ICSI, or IVF is a way of inseminating the egg without injecting the egg. Okay, so now we have a fertilized egg, and then we watch the egg grow over time. So basically, the day after the egg retrieval is day 1, and that's when I tell patients about how many embryos they have or fertilized eggs. And then I give them another report, sometimes on day 3. Okay, so here's the day 1. This is what an egg looks like fertilized. This is what a cleavage stage embryo is. A day 3 embryo should have 6 cells or more and be around grade 1 or grade 2. I talk to my patients about the reports, what they mean to be, how I feel about them. And then we have a morula here, which is around day 4, and then we have an early blast here. You can see an early blast day 5, you can see an expanded blast day 5, and you can even see a hatching blast day 5 or day 6. And sometimes we even see these embryos grow to day 7. And that's at the point that we freeze them or we transfer them 5 days after retrieval, typically. Okay, so you also have the option of genetic testing of embryos. During that procedure, you actually take a small biopsy of the shell of the embryo, and that biopsy is sent to a genetic testing company. The embryos don't go anywhere. Don't worry, they're not getting on a plane. Your embryos are frozen at the IVF lab, and there's no such thing as freezer burn, and they don't continue to grow after they're frozen. Once in the frozen state, you then get the report back from the genetic testing results called PGTA about 1 week later, and then I do a post-IVF consult with my patients, reviewing the results and talking to them about our goals and what we want to do next to prepare for transfer. So now, what is IVF? So IVF is a great way to preserve your fertility. We talk about egg freezing all the time, but we don't talk to people about freezing embryos, because an embryo is what basically gives you the best idea as to what the potential of an egg is. You don't really know until you create an embryo. And so if you're someone who's, let's say, ready to have 2 kids down the line and you're partnered, then it might not be a bad idea if you're, let's say, over the age of 32 to really consider freezing embryos, or even earlier depending on your hormone levels that you've had assessed. Same thing, if you're older, you've already had 1 baby, maybe consider doing IVF to give yourself the best chance for pregnancy. So then the other thing that IVF is good for, maybe women with lower egg counts, blocked fallopian tubes, low sperm counts, a way to rule out genetic diseases. We like to do genetic screening on couples to make sure that they don't share common mutations. And if they do, you can actually test an embryo for the disease. For example, cystic fibrosis is a test that we can do on embryos before we transfer to make sure that an embryo isn't affected or have 2 copies of that gene. And IVF is a great way to get pregnant if you've run out of healthy eggs or have gone through menopause already, because we use donated eggs. If let's say your liver stopped working, you can get a liver donor, and nowadays you can use an egg donor for the same reason, to just live your best life ever and reach your family size goals. Okay, so now, this is a calendar. This is what I do for my patients. I create calendars for them once they decide to go through IVF. Because if someone would just talk to me and just tell me, well, this is what you do, there's 5 visits, you come in, you do these shots and all that kind of stuff, I would be like, hold on, I need it on a piece of paper, so write it down for me. So I write it down, I review it in person, over the phone. I make more calendars based on a patient's schedule. If, let's say, they have a trip and they can't make the calendar, or they can't fit the calendar into the life that they have at the time that I made it. So we certainly rework things, rediscuss, constantly talking about it to make sure that my patients have all their questions answered. And that's a sign that really should be at the front door of my office. Ask more questions, and then also never say sorry. Because oftentimes I hear people saying, sorry, I have this question. And I always tell my patients, no more sorry, and just keep asking questions. So let's just go through this calendar right here. So this is a patient whose period is going to start Friday, okay? Period starts Friday. What does that mean? You think of me. If your period starts, you think of me. Cycle day 1, cycle day 2, you come in. During this ultrasound, I'll look at your ovaries, count the number of follicles. I'll review the protocol that I've decided to use for you, including side effects of the medications we'll talk about, what to look out for, when to reach out to me, when to call me, which is anytime you need. And then we also do blood work, okay? Then if there is a cyst, if your estrogen level is high, if I don't necessarily think that the follicle count that I'm seeing is comparable to previous follicle counts, you will hear from me during that appointment, because I may not want to move forward after that, okay? So then if you get the green light and all clear, then we start injections. It's an injection a night, every night for approximately 10 nights. And during that process, you're coming in for these monitoring ultrasounds before the egg retrieval. And during the ultrasounds, I'm letting you know exactly how many mature eggs I think we're going to get, when the egg retrieval is going to fall, so that you can plan your life around, let's say, abstinence before the egg retrieval, planning your work life, when to take time off. If, let's say, there's 10 or more eggs, you might want to have more than 1 day off after the egg retrieval to recover. The egg retrieval, for some people, it can be painless. It's done under anesthesia. But for other people, the cramping and the swelling, because imagine this, I'm taking a small needle going through the vagina on each side. I call it a vaginal puncture site. There's no stitching, there's no sutures, there's nothing like that. but I'm going through each of those little black circles that I showed you on that image for the antral follicle count. And that can cause bruising of the ovary. That can make the ovary swell. So that might not feel so good, and you might just want to be at home, working from home, and taking Motrin, Tylenol, using a heating pad, and certainly hydrating. So during the process, you might get, for example, a slight headache, a little bit nauseous, a little bit more emotional, egg white cervical mucus. You'll want to slow down your activity levels when your doctor tells you. I certainly individualize that with my patients and tell them when to stop exercising completely. And it's not a one-size-fits-all rule for everybody. And then after the egg retrieval, we always have a plan in place for whether we're going to do a fresh transfer or a frozen embryo transfer. The frozen embryo transfer happens about a month to 2 months after the egg retrieval, and a fresh transfer happens 5 days later, and then pregnancy test is 8 days later. And on the transfer day, I ask patients to have that day off and at least the next day off for rest and relaxation. Good. So talking about the baseline ultrasound, remember, sometimes you go in and you may not get the all clear signal. So that could be super disappointing if you didn't know that. If you didn't know that you might not be starting IVF after your baseline ultrasound, you might be pretty mad if you already bought all the medications, changed your work schedule, asked other people to work for you and cover you and all that kind of stuff. So it's important to just be flexible and think that whatever the plan is, it's supposed to be that way, because your ovaries sometimes have a different plan in mind. So we just got to think that your body is amazing and knows what it's doing all the time. And these monitoring visits, sometimes you find out that the estrogen level isn't rising the way that you want, that the follicles aren't growing the way that you want. I wouldn't want a patient of mine to find out that I wasn't happy with their cycle after the egg retrieval and say to them, oh yeah, after that first visit, I kind of knew that this wasn't going to be a good cycle for us. So what I tell patients is this is a learning experience for us. I'm learning about your ovaries and figuring out that, you know what, this isn't the right cycle. I can already tell. So let's stop medications and rethink things and approach things a different way. So those are the kinds of things that you want to ask your doctor. How many eggs are growing? Are you happy with my estrogen level rise? Do you think that this is a good cycle still? Shall we keep moving forward? And it's not because you're super negative. It's just you always want to be informed and make sure that you're not finding things out after the fact that you should have known while you're going through the cycle, because I don't want you to have what I call IVF disappointment. And then on the egg retrieval day, be sure to watch my show on how to have the best egg retrieval experience. But some of the things I talk about are hydration, having protein shakes, making sure that you have a heating pad, stool softeners so that you're not experiencing constipation, emergency number for your doctor in case you have severe pain or something that you might think is a complication. And then after the egg retrieval, if you're not transferring, that period that comes is usually a lot heavier than you are used to. And the other thing is that your cycle is a lot shorter in IVF because we're retrieving the eggs and your ovulation is a little bit sooner than usual. We're removing cells along with the eggs that secrete estrogen and progesterone. We're not replacing those hormones. Since we're not replacing those hormones, the period comes earlier. I would say I have, maybe a couple of patients a month who email me, Dr. Aimee, my period just started. It's only 10 days after the egg retrieval. My cycle has never been this short. This must mean something bad or there's something wrong. And that's why I want to reassure patients before they even go through an IVF cycle that that's not something that we worry about. It's normal for your period to come even 7 days after the egg retrieval, especially depending on what medications you use. For the trigger shot, sometimes the period even comes sooner. So talk to your doctor about also how to prevent ovarian hyperstimulation syndrome and different strategies that they can use so that you're not going to have any complications from the procedure. And also, certainly you want to know, are you at risk for OHSS? What can make you at risk are high estrogen levels, a high number of eggs. And so that's something to talk to your doctor about first. Thank you guys for still watching. And another thing that is super, super important to me is making sure patients know what they're going to do with unused eggs or embryos. And certainly you have to ask these three questions before you transfer. What do you want? What is it going to take to get it? And are you willing to do it? Ask those questions before you transfer, because by the time you transfer, if you haven't talked through those things, you might feel that you weren't fully prepared, because maybe you have one embryo from your IVF cycle and you really want 2 kids. So it might be a better idea to freeze and not do a fresh transfer. It doesn't mean that you have to do genetic testing. It just means you want to preserve your fertility and bank more embryos. And maybe you're dealing with a situation where you might be having relationship issues. That's another thing, is maybe take time out, freeze the embryo, don't transfer it, and maybe freeze some eggs for yourself before you move forward with anything else. So I'm not going to talk about implantation testing and how I prepare for transfer today, because I really just wanted this show to be a really good overview about what is IVF and what I tell my patients. But be sure to watch my show about how to get pregnant in 3 months or less, or 3 steps or less, because I think that's an important thing for everyone to know, that the first step that I talk to my patients about is making embryos through IVF, and then preparing for transfer through implantation testing, and then transferring. I certainly want people to know about these things before they find out that they have a negative result or could have done something different. Certainly, even when I do these tests, I can't give my patients a 100% pregnancy rate, but I certainly know that I've done everything humanly possible using science to help my patients reach their goals. So like I said, make sure to talk about unused eggs and embryos first, especially embryos, so that if you have a high number of eggs that are retrieved, you have the option to freeze eggs without fertilizing all of them. Talk to your doctor about the IVF pyramid and what that looks like for you. And what I mean by that is you hear patients talk about losing things through the IVF process, and I think of it as gaining things. So let's say you start off with 10 eggs or 10 follicles. Sometimes you'll retrieve 8 eggs. And then as human beings, we think, oh, I just lost 2. And then maybe you have 6 fertilized, and now you're thinking, I just lost 4 because I started with 10. And then you end up with 2 healthy embryos, and you're like, now I just lost 8 and everything's being taken away from me. But if you just change how you think about things and just go into it with a different mindset, then you think of things, I'm just gaining things along the way. I started with 10, but I gained 2, and I have 2 embryos now that I've never had in my life, and that's more than I could ever want, given that I want, let's say, 1 pregnancy. But if it's 2, depending on the quality, you may want to do another cycle. So talk to your doctor about the embryo quality. Quality does matter. Embryos are like diamonds. They get special scores, and every embryo is different. I have patients that come to me for second, third, fourth opinion consults. And after all they've been through, I say things like, what was the quality of your embryo? And they literally say, I don't know. I didn't even know that that was something that I could ask for. So super important to talk about these things as you're going through the process. Know that you can have this information and find out what it means for you, and ask what my pregnancy rate will be with the embryo quality that I have. Super important. And then the other thing, I know, you know, Tushy Method, tushymethod.com. Go to the website and you'll learn about this process. But this is what I start with my patients, because it's so important to do what we can that we have control over to give ourselves the best chance for pregnancy, even when we're doing IVF. I know it's silly to think, well, I mean, IVF fixes sperm problems. Why do I care about sperm? But you should, because every healthy embryo takes a healthy sperm cell and a healthy egg. And sperm does matter. Sperm health is important. You'll have more beautiful embryos if you have healthier sperm. So talking to your doctor about supplements you can take, changing lifestyle factors, lowering your BMI, all super important things on the sperm side as well. And then assembling your fertility team. While I think IVF is very fun, it is a lot of work. So making sure you have your team assembled that can help you through the process. The T stands for therapist, talking to someone about the right eating regimen, exercise for you. Acupuncture, I think, can be really helpful and help with the symptoms and side effects of the fertility drugs. And then M is for mindfulness and meditation, finding a really nice program that you like to follow. And certainly find joy in every day of your life, so that as you're going through this experience, you're not losing yourself. And you're just living your life to the max. And that's certainly what I want my patients to do. You guys, thank you for watching tonight's show. I know this was jam-packed with lots of information about IVF. I certainly didn't cover it all, but I feel like most of it is here, so that no matter who you are, where you are, which doctor you're going to go to, this information will make you more informed, a more informed patient, and now you'll know what questions to ask. Thank you guys for watching tonight, and I really look forward to talking to you guys next week too. Have a great night. Bye, guys.
Welcome to the Egg Whisperer Show, a program exclusively designed to promote reproductive health awareness and discuss fertility preservation options. Here is your host, the Harvard-educated fertility specialist, Dr. Aimee.
She's known as the Egg Whisperer.
Fertility expert Dr. Aimee,
And you have yet another success story.
Just launched by an East Bay fertility doctor.